The Georgia Public-Private Partnership for Teen Pregnancy Prevention, we fondly call it P3, began 5 years ago, and it started when there was an opportunity to apply for federal funding for teen pregnancy prevention, and several of us called each other to put together a collaborative application. So we all got together, and we started with just 5 organizations, and we got together saying, what would we need to leverage this money to leave something that's tangible and infrastructure that we could then take this and move forward. The goal of P3 is to reduce teen births 1/3 by 2020. And we do that by really improving the programs that we have implemented in our state and increasing the number of young people that attend those programs and improving our clinical services and making sure that young people know about those services. We're really looking at changing the systems in our state and have an influence that way. The Leadership Council meetings occur every 2 months for 2 hours, and the first thing we do is a 2-minute drill. What is new that's coming down the pike, or what's happening in your field that P3 needs to know about? And this is our way of keeping our ear to the ground on any innovation, any funding, any challenges, any changes in policy that we may need to know about to capitalize on in one way or another. And then what we do is we give report outs of what each of the work groups are doing and how they're moving the work forward. We also look at who else needs to be at the table. So we're also targeting the adults, the youth-serving providers in the state, the clinical service providers. They're the ones who are intervening with young people at the end of the day. And so we broke into work groups, and those work groups then started moving everything forward. And so what we started to see was entities working together that hadn't worked together before. We have a program work group that looks at how do we increase the number of evidence-based teen pregnancy prevention programs in our state, and how do we build the capacity of those practitioners across the state, and how do we develop a community of practice. And so now we have over 500 practitioners that are tied together in a community of practice, something we never had before.
The work of the program work group really focuses on identifying ways to diffuse evidence-based interventions throughout the state of Georgia, using our network of partners and the organizations that we know are doing this work, and also identifying ways to build the capacity of other organizations statewide to really provide quality teen pregnancy prevention services and programming. Our work focuses on identifying best practices, diffusing best practices, identifying ways to figure out what's happening throughout the state and how we can best possibly unite as partners and ensure that the best quality program is being diffused in the county, in multiple counties throughout Georgia.
We also have a clinical work group, and this clinical work group looks at what are the different policies that we need, how do we support clinicians in our state.
For P3, I've been the champion of the clinical work group. So we are a group that includes clinicians, some from academic centers. We have representation from Voices for Georgia's Children on our work group, CHOA, Grady, Morehouse, Emory, all get a voice. The key focus of the clinical work group is to make sure that young people in Georgia have a place to go to access care with regards to reproductive and sexual health. We want to make sure that young people have access to care, but we also want to make sure that once they get to that care, they're being seen by clinicians who are providing evidence-based care, so up to date, up to the minute, and providing that care in a really teen-friendly manner.
How do we know that we're impactful? We have a way of measuring that's across all of our entities participating. So P3 uses a collective impact model. That's how we've set ourselves up. And collective impact has 5 strategies to it. It's where you have a common agenda. It's a shared strategy of how we're going to get to the end goal. It also requires mutually reinforcing activities. And then all of this is done through a backbone organization. There needs to be one organization that takes the lead, that's kind of pushing everybody and keeping us organized and moving it all forward. And GCAP is that organization that serves as the backbone organization of P3.
I nominated the collaborative for the Joseph D. Greene Community Service Award because I believe the collaborative really embraces and encompasses the true spirit of the award, which is to improve the quality health care of individuals across Georgia. The collaborative is exemplifying the true spirit of this award by working with over 20 public and private partnerships around Georgia to align systems in order to move the needle to reduce teen pregnancy and strategically address this issue.
I think one of our greatest impacts is the change in the Medicaid policy that allows for long-acting reversible contraceptives to be given to women right after given birth. Before it wasn't allowed, not because it was contraindicated, but because there wasn't a charging code, so that hospitals and physicians couldn't recoup their money. And so we worked with Medicaid, and we worked with the Medicaid care organizations to make sure that this policy was changed, and then that hospitals and pharmacies and physicians were ready to capitalize on that. And Georgia became the 5th state in the United States to have that change. That to us was one of our biggest successes. But we also have a lot of other successes of really being able to see different systems changing their practices, public health saying that they're going to use evidence-based programs, seeing that Department of Juvenile Justice is doing the same, and so is DFACS. This wasn't happening before. In the last 5 years, we've seen our teen birth rate drop 45% in 5 years alone. And so that's a testament to a lot of people moving in the same direction.